Social Security has tons of acronyms. It's hard to understand. So my name is Ed Weir, former manager of the Social Security Administration. I've helped hundreds of thousands of people throughout the country, all things Social Security, Medicare, retirement, disability. So we're going to talk about ARF today and why you should know about it and how it just might affect your future benefit for the good or the bad. So we'll talk about that. And if you're new to my channel, you're new to this today, how this works is I talk about the topic, and today should take about 10 or 15 minutes. And then I will open it up for questions. So make sure you type your question in the chat there. If you just want to stick around for the ARF part, then have a beautiful day after that. But make sure you subscribe, and that way you know where to find us again in the future when you, your family, friends, and all that kind of good stuff do have questions. All right, let's go ahead and get started. So the ARF, adjustment of reduction factor. Okay, what the heck does that mean? It's basically you have an annual earnings limit when you collect your Social Security benefits early. This year it's $22,320. And if you go over that amount, Social Security holds back $1 for every $2 you go over that amount. So let's say you go over $10,000 over the 22,000. It changes every year. Next year it'll probably be 23, 24,000 or so. But let's say you go over $10,000 over the annual earnings limit amount. You owe the Social Security Administration $5,000. So what they do is they'll withhold 5 months worth of checks. Either we'll talk about how that's withheld here in a second, but they'll withhold 5 months worth of checks. And what happens is a lot of people don't realize it's, their check is being withheld. A lot of people say, well, I don't believe, they should withhold, when you take early retirement, you should be able to work and receive, Social Security. But that's, it's been like that since 1935. So I don't think that's going away anytime in the near future. So basically you get a month withheld. And if, for instance, you retired 30 months early, you took a reduction by 30 months. And then after 10 months, let's say you get a good job, you get tired of retirement like I did, and you decide to go back to work, and you only technically accepted 10 months of checks. The other 20 months you didn't get. What happens is once you hit your full retirement age, adjustment of the reduction factor. They adjust your reduction factor. So instead of the rest of your life having a 30-month reduction of your Social Security check, Social Security, it's a completely automated system. You don't have to do anything. Once you hit your full retirement age, the computer system looks at your benefits, your benefit history, and says, this person's benefit amount today is reduced by 30 months. But wait a second. This person didn't get checks for 20 months. So the computer automatically reruns it and then recalculates your benefits and puts that 20 months back in there. So you only get a 10-month reduction for the rest of your life. So a lot of people contact me once they hit their full retirement age and say, hey, I was getting, $2,200 last month. And now my check has been bumped up to 25 or 2,600. I didn't know the COLA was that much. Well, in your case, it wasn't the COLA, it was the adjustment of the reduction factor. All right, so a lot of people have questions also about, okay, how do we, how does that work? Is there any way to stop benefits? We're talking retirement benefits and survivor benefits and spousal benefits, but let's focus on retirement benefits because it's easier. So there's 3 ways to stop your benefits. Stop, suspend, withdraw. Social Security uses their own, terminology for each particular one. The first one, if let's say you file for retirement benefits, and then within a year, you decide, oh, this is not for me. You got another job, whatever the case may be. You can actually withdraw your application. So within the first year, you withdraw your application, and you say, yeah, just cancel out my application I did 12 months ago. And the Social Security says, well, if we cancel out, you have to give your money back. And that's part of it. You have to give your money back. All the money you got from Social Security over the last 6, 9, 12 months, you have to pay back in a check, pretty much cashier's check, money order, whatever the case may be. And it's like it never happened. You never filed. It's completely withdrawn. You paid all your money back. And later on, when you hit your full retirement age, you're 70, it's like nothing ever happened before. So that's one way to completely withdraw that application. There's another, it's work earnings report over the annual earnings limit. Okay, so Social Security is getting a lot of flack for overpayments, and rightly so. Anderson Cooper did a pretty good expose a little while ago on overpayment, so they changed the policy. So if you or your family friends have an overpayment, make sure you watch my 2 or 3 videos on overpayments. Explains the new regulations, which will probably be very good for you or whoever has an overpayment. So make sure you watch those. But if you get a job, again, you file for benefits at 62 years old, and after about a year, somebody offers you a job making over the annual earnings limit. If it's under that, it's no big deal. But if it's over that, then you can call Social Security and say, hey, next year I'm going to make, $10,000 over. And Social Security says, okay, that means we're going to hold back $5,000 of your checks. So if you get $2,000 a month, they're going to hold back the first 3 months. 2,000, 4,000, 6,000. They can't do a partial. So if you owe, if you get $1 on that in March, they're going to hold back that whole, check. They're not going to, take $1 and release $19.99. So they're going to hold back 3 checks. And that's another. So if you say, hey, I'm going to make, $300,000, $100,000 next year, they're going to hold back the entire year. And again, you're not losing necessarily, you're not going to get those checks, but you're not losing that early reduction. So again, once you hit your full retirement age, they will look back at that and say, okay, didn't receive the first 3 checks this year, didn't receive the first 4 checks this other year, didn't receive this entire year, and then they recalculate. I have to warn you, it does take a little bit of time. It's not a super quick thing. Like when you hit 67, expect the check to be increased the next month. And we are talking about 1970s, computer technology here with Social Security. So give it about 3 or 4 months for it to actually hit your bank account. All right, so that's one way. And one of the things about the annual earnings report is some people, I'm not saying to do this or anything, but some people, they say, okay, well, I'm going to make $1,000 over. And I know I'm going to owe the Social Security Administration $500 and withhold 1 check or whatever the case may be. But again, Social Security computer systems kind of antiquated. If you call them up, if you're able to get somebody on the phone and tell them, you're going to make $1,000 over, they can stop your benefits. But then, restarting your benefits and changing. And so what some people do is they just say, okay, whatever, I'm just going to go ahead and go over. It's only going to be, $1,000 over, $2,000 over. And then what happens the following year when the Social Security Administration gets your earnings for the previous year, because you file your taxes in April, by April, the IRS gets that, they notify Social Security, and then Social Security looks at it and says, oh, John made $1,000 over, he owes us $500. They send you a nice little letter that says, give us our money, give us our $500 back. So you can do it that way too. So if like, hey, I'm going to be $1,000 over 2,000, I'll just put $500, $1,000 in the bank account, and then when they send me that nice little letter, then I'll just go ahead and pay it. And then it's nothing personal. It's a computer generated letter. Nobody's like, hey, John is working over. How come you didn't tell us? Yeah, don't worry about that. The Social Security employees have they're the lowest staffing in 27 years. So yeah, they don't have time to hold personal grudges like that. So, and then the other way to stop your benefits is what I did a video on a couple of weeks ago, which a lot of people don't know. A lot of Social Security employees don't know. It's called voluntary delayed retirement credits. This is only when you hit your full retirement age. About a month or two, if you want to do this, about a month or two before you hit your full retirement age, 66 and 6 months or 8 months or 67, just call Social Security and say, hey, I want to suspend my benefits. I want to voluntarily stop my benefits because I want the delayed retirement credits. Because after you hit your full retirement age, if you're not collecting benefits, you get 8% per year increase in your benefit amount up to 70 years old. So some people, not many people use this, but I like to get all the information out there. Some people say, okay, I've got a job, I've got my savings and 8% guaranteed per year. Heck yeah. So they stop their benefits at the 67 and wait the 3 years. And now they've got a 24% increase in their benefit amount for the rest of their life. And if you're going to do that, as I said, nobody knows about this. When you go into the Social Security Administration and tell them you want to do this, they will look at you like you're crazy because they don't, 99% of employees don't know about this one either. So that is ARF and how it's calculated and what it is. So again, if you go back to work and you don't receive a particular month check, you're not necessarily going to lose that. You don't get that check back, but you get the reduction factor recalculated into your benefit amount later. Okay, so that is it for that. I kept it to 11 minutes. That one was a pretty easy one, relatively easy to explain. So let's go ahead and get into questions. Already got a bunch of questions here. And let's see here. Arlene. What's up, Arlene? I requested a statement from Social Security and I will only get $1,200 per month. Can I claim on ex-husband but not married for 10 years? No. The regulars to this channel know that the Social Security policy is over 20,000 pages and there's exceptions to the exceptions to the exceptions. But in that particular case, there's not an exception. Although I just did a little short on that, that a lot of TikTokers and YouTubers, give incorrect information that it has to be 10 consecutive years, which is not correct. You can marry a person for 5 years, get divorced from that person, remarry the same exact person next calendar year, and add those times together if it's 10 years. If you were married to your spouse when that person passed away, then it only has to be 9 months. And there are exceptions there. But yeah, it sounds like in your particular case, yeah. Mike Oliver, hello, Dr. Weir, Semper Fi, hoorah, Semper Fi. 0311, perhaps there, Michael. All right. Only if legal married in most states. Yeah. So yeah, you had to be 10 years. But yeah, Michael does point out a thing. There are common laws. Some states do accept common law, and because marriage is a state institution, if your particular state accepts common law marriages, then Social Security has to accept common law marriages as well. Good point, Michael. Thank you for pointing that out. Well, Dr. Thank you for your help. You're welcome. Clap, clap, clap. Okay, Lisa. Hey, what's up, Lisa? Your last year of earnings before FRA has a maximum of 59,000 something. How is that time frame calculated? By calendar year or by your date of birth? I'm trying to figure out time frame to bump up earnings. Yes. So normally before your full retirement age, you have to keep the $22,320. The year you turn your full retirement age, it's $59,520. So you can earn that in the months before you hit your full retirement age. So if you hit your full retirement age in July, from January until June, you can make $59,520. So, and then starting July, you can make $1 million a month, and it doesn't matter anymore. There is no annual earnings limit after you hit your full retirement age. Cynthia, it's unfortunate that SSDI recipients don't have the opportunity to increase their payments, especially when going into FRA on disability. They can. Yeah, it's if you're on disability, you have the ability to work. There's a lot of limitations, but if that work you do is one of your high years, then yeah, Social Security automatically. There's a lot of people that receive disability and get the COLA every year, and then also get an increase of benefits because they paid more into Social Security. And then I think one of the things Cynthia is alluding to is the fact that yes, once you hit your full retirement age, you're no longer on disability. You turn to retirement benefits, and so no more CDRs. And because you're at full retirement age for retirement, you can make $1 billion a month. And yeah, so you can increase your benefits there too. Again, if you're able to work, right? Let's see. So the last one you described, is that for people who had been collecting Social Security at 62, and then you're saying, okay, at 67, they can go into the office and say stop payments. That is exactly what I'm saying. Is that, yeah? So if you collect your benefits at 62 years old, and now you're 67, let's say you're full retirement age, and you're saying, hey, I've got some money, put it away, or I got an inheritance, or I got a job or something like that. And, 8% per year. And, if you can make a, better investment somewhere else, more than 8%, then not a good idea, but hey, 8%. So, and then they say, yeah, 8% per year. You just go into the office and say, yeah, I want to stop my benefits. I want to do it's called voluntary VDRC, voluntary delayed retirement credits. And again, you're going to have to fight a little bit. The person at the front window is going to say, yeah, you can't do that. The person on the phone says you can't do that. And that's why in the video I did, I actually put the PALMS reference, which is the PALMS, which is the manual that all Social Security, again, the 20,000 pages. That's why I put that PALMS reference in the video. And that way, when you call them up, you just say, please refer to RS0020 or whatever it was. And they'll disappear off the phone for a few minutes, and they'll come back and say, oh, okay. Shannon, I wanted to know, because I have kidney disease, if I can get more money per month. I already get SSI and SSDI. Yeah, if you get SSI and you work, then as you know, your SSI benefit is automatically decreased. So that's SSI, the needs-based, welfare-based program. So, all right, let's see. I'm going to move over to TikTok here and see what kind of questions we got on TikTok. On TikTok, please subscribe. I need to start treating you all right there. Former assistant module managers, thanks for informing folks. People need to start gathering this early. Oh, okay. Got a guy. He was a former assistant module manager. So he worked at the processing center, payment center, whatever, in one of the regional offices. And good. Is there an earnings cap when collecting widow's benefits? Yes, exactly the same type of thing. When you take, whether it's early retirement, early spouse, early survivor benefits, you're still under the annual earnings limit. So you still have to stay under that until you hit full retirement age. ARFs and DRCs. Yeah, so many acronyms. I, old sergeant in the Marine Corps, so I had quite a few acronyms there. So I think I spent most of my adult life memorizing acronyms. And yeah, I'm 60 and going to collect widow's benefits at phone appointment in 30 days. Any tips? So survivor benefits, widow's benefits, basically the same. It is the same exact thing. You can start it at 60. If you are disabled, your disabled widow benefit, you can actually start it at 50 to 60 years old. 60 years old. In terms of, so you've got a phone appointment to file for surviving spouse benefits. They'll probably ask you for your marriage certificate and your divorce decree, if it's a divorce type thing, to prove that you had the 10-year marriage in there. But don't sweat that. If you don't have that, it doesn't matter right now. Do your appointment. If people lose money all the time, is that they wait for the documentation to call and schedule an appointment. If you do that, you're probably going to lose money. Schedule the appointment first and then start getting the documents. Some of the times the documents you don't need, like a death certificate, almost all states, I think all states, automatically notify Social Security if someone's passing. So you usually don't even need a death certificate. So yeah, for your phone appointment, be a good idea to start getting your marriage certificate and the divorce decree. But again, keep your appointment. You'll need like a check with the routing number and your bank account, and that's about it. So super easy. Unfortunately, you can't do surviving spouse benefits online yet. They've been trying to do it online, but there's too many variables there. So I don't think that's going to happen anytime in the near future. Widow's benefits. May I switch from my benefits at age 62 to my husband's at full retirement age? Switch from my benefits to 62. Okay, so yeah, kind of. All right, so you can collect your benefits at 62, or if you have an ex-spouse that's deceased or a spouse that's deceased, you can collect survivor benefits at 62 or 60. And one of the strategies that people do on survivor is you can collect the survivor benefits and then don't touch yours and let your benefits go up, and your benefits will continue to increase until you're 70 years old. So that's what a lot of people do. Or you can get benefits on your own record and then collect survivor benefits at 65 or 67. I wouldn't do it any past there because survivor benefits don't get delayed retirement credits. So yeah, so those are the strategies. But if you have a living spouse or a living ex-spouse, you can't do that. You have to file on yours first. So if you have an ex-spouse that's still out there alive and kicking, you have to file for benefits on your own record and then file for benefits, spouse benefits, if your ex-spouse or spouse's benefit is twice as much as yours. And I did a video on that, spouse benefits, 2 or 3 videos on that, explains all the calculations and everything. So oh, okay, I already answered that one. Cynthia, are you saying that going on SSDI at age 63 cost you 8% per year till for all? No, no. On SSDI, there's no reduction on SSDI. If you're 50 years old and you collect disability, then it's as if you waited till your full retirement age. So yeah, SSDI is, SSDI and SSI are the only ones that you don't get reduced for early starting of your benefits. So no, it's not in that case. So should you wait until you're 67 to retire? Yeah, I did a video on that about there's just too many variables: health, your genes, if you need the money. So yeah, there's tons of different variables, and nobody. The number one is I can tell you 100% when you should retire, when you should have started your benefits. 100% accuracy. I can tell you better than anybody in the country. 100% accuracy when you should have started your benefits the day you pass away. And so basically nobody knows. So if you know exactly when you're going to pass away at 67, at 70, 80, 120, I can tell you exactly. You tell me exactly when that day is, and I can tell you exactly. Oh yeah, you should have started at 62 or 65, or you should have waited until you were 70 years old. But we don't know. Hopefully, we don't know. We don't know, and that's why it's all just a guesstimate. Just do your best idea of your health and your family's health, and whether you need the money, whether you got children under the age of 18 that can also get benefits, and whether you can switch from retirement to survivors and spouse benefits. And so there's just so many variables. That's why I've got over 300 videos and counting on all of this stuff. So hopefully I've kind of addressed every particular situation so you can make an informed decision. All right, I have been denied disability 4 times. Wow. Unfortunately, one of my doctors made a huge mistake diagnosis. Wow. Yeah. So hopefully, when you say you've been denied 4 times, well, there's no hope there. I got all right. But hopefully, it's not you filed 4 initial claims and were denied initial claim 4 times. Hopefully, you went through the entire thing. And I did 4 videos on this about a month ago. You filed for the initial claim, and then you filed a reconsideration and appeal, and then you did another appeal to the administrative law judge, and you went through all the steps, because the administrative law judge, it's they have a lot more latitude and freedom to kind of read between the lines of some of the black and white regulations and laws, and sometimes they're it depends on what kind of judge you get and everything. But watch my 4 videos on disability if you're interested in trying it again. And yeah, I'll give you a bunch of tips, tricks, and secrets on how to get your claim approved. Always been single, no kids. Should I collect at 62 or wait until FRA? Yeah, again, completely it's individual decision. If again, the number one thing is if you're working, making over $22,320, then Social Security is going to withhold benefits. So if if that's an issue, then there's no use in collecting because it's all going to be withheld anyway. Again, they'll you know readjust it later, but it doesn't really matter because you won't get anything now from the beginning. Um, but yeah, if you're not working, then you have to look at a lot of variables. You're going to get reduced. Your monthly benefits going to be reduced because you're taking it early. But if everybody in your family lives to 80s and 90s, then it might be a good idea to wait until your full retirement age, right? Uh, is there 25% cut if I take an early retirement at age 62? Yeah, it's about 30% or so. If I get widow's benefits and got laid off and wanted me to put 4 apps a week, if I get widow's benefits and get laid off. So, okay, so yeah. So yeah, if your situation changed, a lot of people they file for Social Security or survivor, widow's benefits or spouse benefits or whatever the case may be, and then again a year later their situation changes. So that's fine. Social Security understands that. You can change your situation with Social Security. Say, hey, call them up and say, hey, I'm going to go back to work. Here's how much I'm going to make, and they'll withhold whatever checks as necessary if you want to avoid that whole overpayment thing. Will SSI benefits still be available when I retire in 20 years? Well, SSI is the welfare-based program, so not sure about those. You're probably asking about Social Security, not the welfare part of it. And nobody knows that. That's completely 100% dependent on us. If we're willing to call our representatives and hold them accountable and say, hey, Social Security has been around since 1935. It's treated my parents hopefully well. It's treated me hopefully well. It's not the perfect system in the world, and I would like for it to be around for my kids and grandkids. So if you want that, if we all want that, then that's what will happen. So if we're too interested in cat videos and what Kim Kardashian is doing, then there's no telling. Why do a VA refuse to pay widow's benefits to a World War II spouse? Yeah, I'm sorry. Even though I'm a vet myself, I don't do VA type stuff. I don't know the programs. Eventually, once we get more subscribers and likes and all that kind of good stuff, I'm going to find someone that retired from the Veterans Administration to field these type of questions. I was married 14 years, now divorced. Am I entitled to any benefits? Yeah, you've definitely met the 10-year marriage requirement. And then the next requirement is that your ex's Social Security benefits, the full benefit amount is more than twice yours. So I just did a video on this, yesterday, day before yesterday, on divorced spouse benefits, and I put denied. And so make sure you watch that because people that are denied, they think, they're denied forever. But often it's, well, your ex-spouse's benefit amount is just not twice as amount as yours, twice as amount of yours. But that's because that person is living. And when you have a living spouse or ex-spouse, you're only entitled up to 50%. But when that person passes away, you're entitled to up to 100%. So I guarantee you, there's probably tens of thousands, hundreds of thousands of people out there that need money that have it available, but they walked into the Social Security Administration office or called 5, 10 years ago and to see if they're entitled to benefits on an ex-spouse's record. And at that particular day, because the ex-spouse was still alive and their PIA, their benefit amount was low or whatever the case may be, the Social Security employee says, no, you're not entitled to benefits on that record. And they figured, okay, I'm never entitled to benefits on that record. And now I guarantee you there's someone in your town that's their experience, and they're walking around every single month and they're losing hundreds, $1,000, $2,000 a month that they could really, really, really need. So yes, I am super annoying about subscribing and sharing and liking because that's how the word gets out there. If the word doesn't get out there, then I'm just some idiot talking to a camera all day. Well, as my old Marine Corps drill instructor would say, you are an idiot. So there's that. Um, so please get this information out there. When you switch survivor benefits from theirs to yours at full retirement age, can this be done over? And it gets the question is cut off. So let's see here. I live in Ohio and was married 7 years, but we're together 17 years. Would that be considered common law marriage? I'm not sure about Ohio. Yeah, each state is completely different. Oh, and the second question on that is over the phone. Yeah. You can pretty much since the whole pandemic thing, you can do almost everything on the phone nowadays. If any documentation is needed, then you can just mail it in and stuff like that. So yes, you can do that on the phone. Going back to the question on common law, I'm not sure about. I don't have all the states memorized. I think doesn't Ohio have common law? My grandparents are from Ohio. Worked at the Goodyear plant in Akron there. So I'm not sure. Yeah, I think. But anyway, check your state and or call Social Security, the local office. The local offices in those states that have common law marriages, they know the local laws and stuff because they have to deal with it all the time, and they know exactly what type of documentation you need, to show that you actually live together and all that kind of stuff. So yeah, I would definitely check to see if and if it's someone says, well, I don't live in that state anymore. That's fine. If you lived in whatever state, 20 years ago with someone for 10 years or plus, and it was a common law state at that particular time, then yeah. What I say about there's exceptions, the exceptions, the exceptions. So that is a possibility. If you are on Medicaid at 62, do you have to draw Social Security at 62? Medicaid, yeah, sometimes they do that. I know for SSI, for the welfare-based program that Social Security administers, if you're receiving SSI because it's a welfare-based program, if there's any other money out there that you have access to, you have to take it if you want to continue your SSI. So your state Medicaid just might be the same type of thing. And they say, hey, we're paying for your Medicaid and we're paying for this, that, and the other, but you've got $2,000 worth of benefits sitting there that you have access to. So, you know, you have to get it. So there's very good chance. I'm on disability. What happens when I turn 62? Nothing at all. If you're on Social Security disability insurance, if you're on SSI, then as I just talked about. But if you're on regular Social Security disability insurance, SSDI, then nothing happens. Once you hit your full retirement age, then something happens, but you don't realize something happens. It just Social Security stops taking your money out of the Social Security trust fund, the disability trust fund, and starts taking out of the retirement trust fund. Your check stays the same, your pay date stays the same. You don't have those CDRs anymore, which is an awesome thing. You can work if you're able to work, and Social Security doesn't care anymore. You don't have to report anything. You can make $1 million a month because you're on retirement and you're after your full retirement age. But yeah. But if you're on disability, one thing I do recommend is before that, when you hit 65 years old, you have an opportunity to get a Medicare supplement plan. Those are the Plan G and the Plan N that a lot of states don't have those available to people on disability. And so people just, the only alternative is Medicare Advantage with the pre-authorizations and the networks and everything, and then nickel and dime here and there. But once you get 65, you're in your golden opportunity, and you can get any Medicare supplement, a G and N, and you don't have to pay extra, and you don't have to go to health underwriting. So what a lot of people do on disability, once they hit 65, at the very, very least, check out your options. And I did a video 3 or 4 weeks ago on the differences between Medicare Supplement Plan N and Plan G. And because so many people needed help and there were so many bad actors out there, I decided to put together my own network team of Medicare insurance brokers. So email me or call me and say, hey, I want to check out my options for Medicare Advantage or supplement or whatever the case may be. And I will have someone reach out to you and give you all your options completely free and no obligation, of course. How many hours can I work and what is the amount while I'm on SSDI? Yeah, so that's a whole nother long video. I've done a few videos, I think, on that. It's SSDI work limitations. There's the trial work period, the first 9 months. You can make $1 million a month. After that, any month you go over the SGA, which is $1,550, then you don't get that particular month. So you can contact the Ticket to Work. You can contact your local Social Security, and they can find out whether you're in your trial work period, and they'll give you all the details on that. Or again, watch my videos. The whole work and disability is super complicated. All right, let's see here. Let me get back to YouTube and ask. Uh, Hopefully, I'm not jumping anybody. When I call Social Security to inquire about divorced spouse benefits, they told me they couldn't talk to me about it until I filed for it. I was already on SSDI. Did they mislead me? Kind of, sorta. Um, they don't want to give out, your ex's private information. I understand that, but the trick is you set up an appointment for a claim, and once you do the claim and you provide information that you were married to this person, the marriage certificate and divorce decree, then they can give you numbers. Because until then, you're just someone off the street wanting to know this person's information. So, but one of the things is that they won't set up an appointment for you unless there's money. So if the person on the phone says, "Yeah, you have to set up an appointment," that's kind of a good indication, perhaps. Depends on how they phrased it. But if you tell them that person's information, their name and everything, and they look up that person's record, and they see that there's no money there, they'll say, "No, we're not going to set you up an appointment because there's no money there. It's a waste of an appointment." But if they say, "Oh, okay, when would you like to come in?" Aha, that means that there is money out there for you. And then you go through, but again, as I always say, these just because you have an appointment to apply for something doesn't mean you have to pull the trigger. So when you go to the Social Security Administration to evaluate your options about spouse or ex-spouse or surviving spouse or anything like that, you do the claim, you provide the information, and the Social Security employee, the claim specialist, will tell you, "Okay, when would you like your benefits to start?" And then you say, "Well, let's say if I started this month, how much is it going to be?" And they'll say, "Okay, this much amount." And then you say, "Okay, what if I started a year from now? How much is it going to be?" And they'll click the change the month of entitlement, and they'll kick out the number, and they'll say, "If you start next year, it'll be this amount of money." And if it's a slam dunk and "Okay, I want to start right now," then you just go, "Okay, let's do it." But if you say, "Oh, let me think about it for a few days," or, "Oh, okay, I'll come back next year." Social Security employees have way, way too much work to do. And if you say that, they'll be crazy happy, because that means they don't have to take your case back to their desk and adjudicate it. They just like, "Okay, well, all right, I guess that's it. That's it. I don't have to worry about your case. I've got another 400 cases I have to work on." So don't feel pressure. Don't let them pressure you. You can get your information, get definitive information, and then, think about it, or, come back next year or 2 years from now. So yeah, that is an option. That's why one of the reasons there's some companies out there that offer, an analysis of your benefit amount and all this. They do all the calculations for you. They charge you crazy amount of money, $300-400. Um, and I've seen a lot of those, and they're never right. They are never right. They're completely off on future colas because nobody knows future colas, and they don't know your entire work history, and they don't know spouses or ex-spouses, PIA and your PIA, and so yeah, they're never right. So you just guesstimate, and if you're down to the point where you want definitive, down to the dollar, um, real numbers, then you actually have to file a claim. Nobody can tell you really what your benefit amount is until you file a claim 100% with accuracy. Once you file a claim, and again, you don't have to, you don't have to adjudicate, you don't have to pull the trigger on that. It doesn't have to be adjudicated. You don't have to go through it. You just say you file the claim, answer all the questions, and then they can tell you definitively how much your benefit is going to be, and then you make the decision. So, sorry, I think I belabored that point a little bit, but it's an important point. I think I skipped. I've skipped a bunch. Sorry about this. All right, let's see here. Thanks for your help to us. My question is, if I own property, will this be a factor as to your Social Security income or Medicare? Um, Retirement, no. Survivor benefits, no. Spouse benefits, no. Just SSI. Yeah, if you own a separate property other than your house, it will affect SSI, which is a welfare-based program. And Medicare, only if you sell it. I'm come back tomorrow. I'm doing a video on selling of your home and the Medicare penalty. Not really penalty, premium anyway, but all right, let me see. That was a follow-up question for me, Ed. Thanks, you answered it. Perfect, awesome. Christine, do we need two separate appointments to file on our own and then ex-spouse Social Security? Nope, nope. You can do it all at the same time. So if if you're continuing to talk to your ex-spouse or even your current spouse, what happens is you need three claims. Again, if they're filing, they file, then hand the phone over to you. You file for benefits on your own record, and then you take another claim to file for benefits on that spouse record. But remember, the independently entitled divorced spouse, your previous spouse doesn't have to have filed. So, all right. I already got that one. Q. Hi, Dr. Ed. Reviewing work history, and some years the state of Maryland did not show the total comp, but does show taxable and Medicare tax. All right. So I wonder, the state of Maryland, does the state of Maryland pay into Social Security? Because some states, some cities, some counties have opted out of the whole Social Security thing. There's probably about 5 or 6% of workers out there that don't pay into Social Security because they're government employees and federal employees. Nowadays, 99.9% of them pay into Social Security. Politicians pay into Social Security. That was changed back in the 1980s. But some states and local governments don't. And maybe Maryland didn't. And therefore, that's why you don't show anything in your earnings record. But even if they don't pay into the Social Security part of FICA, they do pay into the Medicare part of FICA. So you might be, and this is something that a lot of these workers out there don't realize, that, oh, I don't get anything from Social Security because, I work for a government agency that didn't participate. But you did probably participate in the Medicare part of that. I don't think I've seen a state or a local government that didn't do the Medicare part of it. So you're insured for Medicare. Can I call you when I go to the Social Security office for IEDS? First was told that I had to wait for my ex to retire. And the second time I was told that I would lose my disability if I collect my ex's IEDS. Yeah, I do very, very limited appointments to kind of fund this whole free stuff. You really need to talk to, again, don't talk to, you have to talk to the people at the front windows. Again, those are customer service representatives, they're masters of all type thing, but they're not masters of particular program you need to talk about. You need to talk to the actual claim specialist and tell them, wait a second, I'm filing for IEDS, and the very definition of independently entitled divorced spouse is that the previous spouse did not file. And every Title II CS person in that office knows that. And then about you losing disability. Again, if it's SSI, then yeah, you'll lose SSI if you get more money from the regular spouse benefits. But on disability, yeah, I'm not exactly sure what they're talking about there, but I would file, if they have to give you a definitive, they just can't, over the, across the window saying, oh yeah, you're going to lose your SSDI. Says, okay, well, show me, and, give me a decision. Don't just, rattle something off the top of your head. Um, show me or make a decision based on that. And then you can request a reconsideration of that decision. So if you go back to work after FRA, are you paying into Social Security, and does that help with your retirement at age 70? So what I'm asking, will it increase my Social Security benefits at 70? Yes. If you continue, yeah, number one is yes, you have to pay FICA tax for the rest of your life. Again, unless you work for one of those state or local agencies, but you have to pay FICA tax for the rest of your life. And if it's one of the high 35 years, because that's how your benefit is determined, by your high 35 years. If it's one of your high 35 years, then Social Security automatically recalculates that every year. They see your earnings pop up from the IRS and they say, oh, this is a high 35 year. They kick out one of the low ones, stick in the new one in there, recalculate, and you get your benefit increase. And that's 100% automatic. And be careful looking at your work history, online, and say, okay, hey, I worked in 1975, pumping gas, and I made $20,000. And this, last year I made $100,000. So that $100,000 is definitely going to kick out that $20,000. Maybe not, because that $20,000 is indexed for essentially wage inflation. So that $20,000 in 1975 might be worth $120,000 now. So take that into consideration. Thank you for taking my question. I'm applying for SSDI. Yeah, make sure you watch my 4 videos. I got a bunch of tips, tricks, and secrets in there about filing, to make sure you're doing the right thing and going through the right bureaucratic process. Okay, I think I answered that one. I'm jumping back up to ones I missed here. I'm 64, applying for SSDI, but if approved, but the amount is less than my FRA, will the payment the full FRA, or will they keep me at the SSDI amount? No, yeah, it's basically probably what the difference is there. When you're looking at your full retirement age amount, but when was that estimate generated? Because what happens if you look at your statement online and it says at your full retirement age of 67, you're going to receive, $2,000. And you pull up that estimate when you're 60 years old, and then as soon as you pull it up, you stop working for the next 7 years. And because Social Security adds that in, they project and they says, okay, you're making X amount, and we figure you're probably going to make the same amount until you hit 67. And that's how they come up with that, that full retirement age estimate is based on projections of you continuing to work. So if you stopped working or reduced your work considerably, then those estimates are just way, way off. So, okay, let's see. Did I already answer? Yeah. Some Penelope, awesome. According to my Google search, Ohio does not recognize common law. Wow. So there's all right, there's that. Arthur turned 70 in early March. How far ahead do I need to file, or should I start in January and just lose $20 a month over lifetime? Yeah, that's a lot of people. Yeah. So if you're going to start your benefits, you're considering, you might start it in January. I would call November, December, and because it only takes a month or 2 months, 3 months prior to when you want to start your benefits. That's plenty of time, and a lot of people do that. 3 or 4 months reduction. Looks like you already calculated it's 20 months for the rest, $20 a month for the rest of your life. But then again, you're also going to get those 2 checks or 3 checks ahead of the game. So that's $2,000, $4,000, $6,000, for instance. $6,000 divided by $20, it'll take you what, 14, 15 years to make up the difference. And so you could have a nice little, Hawaii vacation, or pay off some, debts or something like that, or, do something. Um, if we find an error in the earnings record after filing for Social Security, can this be corrected after benefits began? Yes, but this is the one that has about a billion exceptions, and nobody at Social Security can understand some of this stuff. Is when you can correct your earnings record. That's why I just repeat ad nauseum about, once you file your taxes, you're not done. Go into mysocialsecurity.gov when you're 20, 30, 40, 50 years old. Every year, check to make sure the Social Security got your earnings record correct. Because once you get 62, 65, 70, or whatever, and then you say, hey, they don't, I'm missing this year 10 years ago, 20 years ago. And then there's this kind of limitation where, depending on a particular situation, you can't change it after 3 years, 3 months, and 3 days. I don't know why they do it like that. But super long story short, if you've got the proof that a particular year is incorrect, take it down to Social Security. And the kind of the statute of limitations is, again, people just don't understand it. So sometimes they're like, whatever, I'll just go ahead and add it in there. So, and yeah, you can do that at any time. So even after you're receiving your benefits. So if you find that your earnings were incorrect and you take them down there and get them corrected, then guess what? They will go back to day one. So if it was 10 years ago and you just started collecting your benefits 2 years ago, and it increases your benefits by $10, then they'll give you $10 a month for every month. They'll give you one check, one added check for all of those. So, Scorpio rising, can one expatriate to another country and still receive SSDI? And if so, what about the Medicare charge? Yeah, just did a video on that, on living overseas. Yeah, if you're an expat, you can live overseas and receive retirement and disability insurance and all that kind of good stuff. Can't move to Cuba or North Korea. Social Security can't send benefits there. But yeah, pretty much anywhere else you can. If you're a U.S. citizen or green card holder, there's some limitation. If you're a U.S. citizen, it's super easy. In terms of Medicare, this is a question I get all the time. I'm moving overseas, and do I have to pay for Medicare? It's completely your decision. If you're going to be moving overseas and 100% for sure you're never coming back, then yeah, maybe don't get, Part B of Medicare and, pay the $174. But I've also been contacted by a lot of people. They've been overseas for 2, 3, 4 years, and the political situation gets this, and the inflation rate turns this, or they get loany for their parents, or they have a medical issue that can only be taken care of in the United States, or whatever the case may be, and then they have to come back, and they'll have to pay a penalty for the rest of their life. And invariably, whatever happens in the middle of the year, and they can't sign up for Part B until January, because they're out, they're in their general enrollment period. So you sign up in January and your Part B will start in February. But again, Part B, it only covers 80%. So if you have to come back in July of something, you have to pay everything from July until February. So yeah. Julie, thank you for all you're doing to help U.S. citizens. Yeah, you're welcome. Thank you. Christine, thank you for the information. Appreciate it. Yeah, you're welcome. Do I have to be collecting Social Security disability to claim disability for a child? No, not necessarily. You can. That is one way to do it. So yeah, if you have a child, the child is disabled, then the child can get SSI disability, the supplemental security income. And again, it looks at the income and resources in your home and everything like that. So a child can get SSI disability. If you are receiving retirement or disability benefits, then the child can receive benefits from your record or the deceased's record. So yeah, and they can get those benefits up until they're 18 years old. And if they were disabled before the age of 22, they can get disability benefits pretty much for the rest of their life, as long as they're continuing to be disabled. Lisa, if I choose SUP Plan N, will I pay both Part B and the SUP premiums? Yes, that is the fact with all of them, that in order to get a Medicare Advantage, even those zero premium plans, that you have to have Part A and Part B. So you have to be paying the Part B premium, unless you have the state to pay for your Part B premium for you. And I just did a video on that on the Medicare Savings Program. But if you're looking at Plan G or Plan N, yes. So you'll have to pay the Part B premium. Part A premium is free. So you got the Part A, you get that for free. You get the Part B, you have to pay the premium on that one. And then you have to pay the premium for Plan G or Plan N. That's why I like N myself, because I'm cheap like that. I like to save money. So N monthly premium is cheaper, pretty much across the country. And, it doesn't cover as much as G, but most of the stuff that N doesn't cover, watch my video on the difference between G and N, and you'll understand why I like N better. And then the Part D prescription drug plan, you'll need a Medicare prescription drug plan as well. Those are relatively inexpensive depending on your area. There's some out there this year, it's like $1 or $2 or under $10. But if you have a prescription drug plan or a Medicare Advantage plan this year, yeah, there's going to be some big changes coming, because there's all kinds of different laws and regulations. So this is the most important year. So please get the word out to people that this is probably the most important year in quite a while, that you really, really need to keep up on your Medicare Advantage plan and your Part D prescription drug plan. The Medicare supplements, they don't change, so you're good there. But the Medicare Advantage plans, you really, really have to check when the new plans come out in October, because you don't want surprises starting January 1st. And I think we're going to get a lot of people on here. It says, I didn't know they raised this. I didn't know they raised that. It was still zero premium. It still had my doctor. So I was good with it. And then everything else changed. You don't know until you don't know. So please, please pass the word out, tell people to reach out to, whoever signed them up, or their agents or whatever, or give us a call, and I can find someone to help them out and treat them right. Mama Deb, hey, what's up, Mama Deb? Haven't seen you in a few days. I'm already getting early retirement benefits, and I have to make an appointment to apply for SSDI in office. It won't let me apply online. Yeah, because you're currently receiving benefits. So, Mama Deb, yeah, you're under your full retirement age. So yes, you can file for retirement benefits and disability benefits. You can't get both together, but you'll get the higher of the one. And if you get your disability insurance, you can also get Medicare quicker than 65. Yeah, so you have to go into an office. Yeah, the computer system is just not that smart. And may I apply for phone for SSDI? Yes. Yep. You can do it on phone. No problem whatsoever. Christine, does regular Medicare and supplement cover medical emergency on an overseas vacation? Some Medicare supplements do. Yes. A lot of Medicare supplements cover emergency, the G and the N. Medicare Advantage, not so much. Original Medicare, pretty much, a lot of these things, it's the way these companies word things. Oh yeah, Medicare covers, overseas, but it's if you're like in near the Canadian border, and the Canadian border is like right there, and right over the border there's a hospital, and you have an emergency, it'll cover it because the hospital is like right there, because it's an emergency. So but if the American hospital is like 50 miles away, it'll cover the Canadian hospital, but you just can't go to a Canadian hospital just because so again, it's very, very, oh yeah, we have overseas coverage. I'm like, oh really? Let's hear about the details of that. All right. Is filing for Social Security retirement best done online? Yeah. Yeah. A lot of people like doing the online retirement. But the most important thing is, again, always check your earnings record. Make sure everything is correct and you don't have any gaps or anything there. Connie, I've heard conflicting answers to my question. Really? In Social Security, they give you conflicting answers? I would have never thunk that. Yeah, that's kind of one of the reasons I'm up here. Okay, I'm currently on Social Security. My spouse is going to retire soon. When he files, will we both get our full benefits, or will one of us get a reduction? Okay, yeah. So both, all whatever answer you got is correct, depending on the particular situation. Okay, so your husband is going to file for soon. So if he files early, he's going to get reduced. If he's filing as full retirement age, no reduction. If you are going to file for spouse benefits on his record, if you're filing before your full retirement age, you will be reduced as well. If you're both your full retirement age, then no reductions whatsoever. So all of the answers you got are correct, depending on the particular situation. Dun, dun. Can service connected for hearing loss at 100% help when filing for SSDI or hearing loss has no way in the matter? Yeah, everything. Yes, everything is included in there. So watch my videos on disability, and just don't put your major disabling condition in there. Say, okay, here's my major disabling condition, and here's the medication I take because of that. That makes me feel drowsy all day, or makes I have to go to the bathroom 20 times a day. And here's another thing. So make, this one alone, this one alone, this one alone might not get it. But if you add all three of those together, there's a better chance of you being approved for disability. So, Arthur, can you collect on spouse's employment record after full retirement age and hold off taking mine till 70? No. Unless you're only on surviving spouses can you do that. But no, you have to file for benefits on your own record first. There was an old system that stopped in 2016 that allowed you to do stuff like that. But yeah, you can't do that anymore. Thank you so much. Wonderful blessing. You're welcome. Lisa, good night, everyone. See you tomorrow in the Irma live stream. Yes. Okay. That's right. Irma's tomorrow. Oh, yeah. Irma and selling the house. Yes. Okay. All right. Let me get to TikTok here. 60 on disability. Do I collect that for life? Yes. If you're on disability and you continue to be disabled, you collect that for the rest of your life. But you collect that amount of money, but technically you don't collect disability. You, at your full retirement age, your disability is switched to retirement benefits. So, but it's the same amount of check and all that good stuff. All right, we are at over an hour, so let me do one more question and then we'll call it a day. Brenda, my husband and I filed at 65 last year, and I filed at 62. He also received a check for 11,000, but I have no idea how he got that. I asked him, but he never responded. Well, yeah, that's yeah, not sure about whether it's a retroactive pay or what's going on there. So, all right, I think that'll do it for tonight. Make sure you subscribe, and TikTok, please subscribe there. Come over to YouTube as well. And that way you can see all my screen and all the stuff I put up. But y'all have